As with most of these techniques that you've heard about today and seen, patient selection is critical. The patients that I do this procedure on typically have massive supraspinatus and infraspinatus tears. The common theme is tendon loss. They simply don't have tendon, and everything lateral to the cable is atrophied. So if you try to bring that edge to the bone, it's going to fail. These typically are not acute tears. Those have plenty of tendon, and you can repair those. These patients also uniquely don't have glenohumeral arthritis. This is not a procedure to perform if you have a glenohumeral arthritis, and you can see in both videos, these patients' cartilage is well preserved. The other exclusion is hematophores and 5s. Obviously, it's a matter of the preservation of the cartilage and the glenoid wear that you see with those patients, and pseudoparalysis is also a contraindication to this procedure. So how do we get here, and what is this? Why do we do it? The procedure is predicated on what we've learned from our experience with SCRs. The study that caught our attention in terms of this was the study done out of Kaiser in 2019 that looked at failed superior capsular reconstructions, and this MRI is from that series of patients where they noticed that when the SCR failed on the glenoid side of the joint, the patients actually still had improvement in pain and function. When it failed on the humeral side, it was a different story. On the right is a video of a patient of mine who had a superior capsular reconstruction, was in physical therapy and felt a pop. We went back in. This patient surprisingly didn't have a lot of pain, but there was concern about what that pop was and where this came from. Not surprisingly, the radiologist had interpreted this as a type 2 failure of a rotator cuff repair. So this is what we saw. And again, you can see that the humeral side's incorporated. And this led several people to think about the possibility that maybe we can do a procedure that doesn't involve the glenoid, that's easy, and that can still improve the patient's outcomes.